Accidents and first aid. When an accident occurs and you or someone else is injured, report it immediately to your supervisor. If you are injured by a chemical in any way, go to the vehicle and locate the binder with SDS sheets. Find the chemical that injured you, look under the section titled First Aid Measures, and follow the recommended procedures. If an injured worker needs immediate medical attention and the supervisor is not present, use a phone to contact local emergency services right away. Emergency phone numbers are posted with your SDS binder. Inform your supervisor of the situation at the very first opportunity so the proper OSHA forms can be filled out. This is a copy of the OSHA Form 300, which is a log of work-related injuries and illnesses. OSHA First Aid Requirements. The Occupational Safety and Health Administration, OSHA, has certain requirements regarding first aid and CPR preparedness in the workplace. First aid supplies should be readily available to all employees. OSHA Standard 1910.151b states that an employer must have adequate first aid supplies readily available, although specific first aid supplies are not listed in the standard. OSHA does not have a minimum requirement, but ANSI, American National Standards Institute, does. A basic workplace first aid kit should include at least one absorbent compress, 32 square inches with no size smaller than 4 inches, at least 16 adhesive bandages, 1 inch by 3 inches, 1 roll of adhesive tape, 5 yards total, at least 10 packets of antiseptic applications, 0.14 fluid ounces, at least 6 applications of burn treatments, 0.14 fluid ounces, 2 or more pairs of medical exam gloves, latex or non-latex, at least 4 sterile pads, 3 inches by 3 inches, 1 triangular bandage, 40 inches by 40 inches by 56 inches. Additional but optional items include 4 2x2 inch bandage compresses, 2 3x3 inch bandage compresses, 1 4x4 inch bandage compress, 1 eye patch, eye wash solution, 1 chemical cold pack 4x5 inch, 2 roller bandages 2 inches wide, 1 roller bandage 3 inches wide, CPR barrier device. Any concerns about OSHA compliance for your company should prompt you to provide first aid and CPR training to employees. OSHA has partnered with the American Red Cross, ARC, to determine training standards. The American Red Cross recommends updating first aid training every 3 years and updating CPR training every year. Cardiopulmonary resuscitation. Know your ABCs: airway, breathing, compressions. Airway. A clear airway must be quickly established and maintained with the head tilt, chin lift maneuver. Foreign bodies should be removed from the mouth. Breathing. If the patient is not breathing adequately, intermittent positive pressure ventilation should be started once the airway has been cleared. Mouth to nose, or mouth to airway ventilation should be carried out until a self-inflating bag and mask are available.